Hello, hello. So today we're going to talk about medication treatment for depression. I mean, there's so many medications out there, so how do we figure this out? So it goes like this. Antidepressants. I need an antidepressant. Antidepressant. Which kind of antidepressant? Yep, to choose an antidepressant. So I think the first thing to know is that people don't always, they think they need, but they don't really need an antidepressant. They'll come into my office and they say they're going through a hard time. They want to take a pill to take care of it. And I say to them, I'm not convinced that your kind of depression means medication. So oftentimes I advise them to get off the couch and exercise. At least 20 minutes a day, 6 out of the next 7 days. Do that and come back in a week and let's see where you're at. Sure enough, they do that. They come back in a week and many times they say, yeah, doctor, I am feeling a lot better. Maybe you're right. Maybe I don't need an antidepressant. Hopefully they'll keep on exercising. Next is to know that the first law in psychiatry is to see if there's some physical reason for what's going on, what we call an organic cause of their depression. For example, let's say somebody's had a stroke, and especially if it affects the left frontal lobe, that could result in a profound depression. Parkinson's, well, that depletes dopamine, which is the pleasure neurotransmitter. Then there can be hypothyroidism, and simply giving them a thyroid medication can make a world of difference, and you don't need a specific antidepressant. There's hormonal changes that happen. Thus we see postpartum depression. There can be B12, low B12. There can be low iron. There can be medications which can create depression, like beta blockers for high blood pressure. Steroids, they can wreak havoc in somebody's brain. Of course, alcohol, that can deplete neurotransmitters, and marijuana long-term can result in apathy. So we need to look at an array of different physical possibilities that could be behind their depression, and maybe that's the first line of treatment before jumping to taking a medication specifically for depression. However, of course, there are those times when somebody truly needs an antidepressant. In general, I divide antidepressants into 4 categories. First of all, there's the serotonin antidepressants, the most famous of which is Prozac. There's also Zoloft, Lexapro, Paxil. They can be extremely powerful. They're probably the most used antidepressants throughout the world. Then there is the combination of serotonin and what we call norepinephrine. And those are Effexor and Cymbalta. Again, can be very powerful. Then a couple of what I call atypical antidepressants. There's Wellbutrin, which primarily works on dopamine and norepinephrine, can be very energizing, motivating kind of antidepressant. Then there's Remeron, which is used, oftentimes can help with insomnia or to build up appetite. For example, we'll see in nursing homes, an elderly person, they've lost their appetite, they aren't sleeping at night, and Remeron can help them enormously. Then there's what we call the tricyclic antidepressants. These are sort of the old timers, like imipramine and nortriptyline. They can especially help perhaps when the others don't work or when somebody's having a real profound kind of depression. So again, how to choose all these possibilities. Antidepressants. So oftentimes we doctors, we look at other kinds of things in order to make our choice. For example, what has worked in the past? Sometimes they've been on something in the past that worked. Or maybe it sort of worked, but then they had side effects. So maybe we can try it again, maybe starting at a lower dosage. Is there a family history of depression? Perhaps a kind of medication that somebody else in the family took that worked for them. That can be a go-to choice. Then if somebody's having, let's say, a lot of anxiety or irritability, I would usually pick the serotonin, the Prozac, Zoloft, Lexapro kind of medication, which oftentimes needs sort of high dosages to not only help the depression, but to help with the anxiety. If someone's having a hard time with concentration or low energy, Wellbutrin can be extremely powerful. Suddenly they're filled with all sorts of energy, and indeed, their ADHD is much better. Let's say they're having a hard time with sleep or with appetite, they're losing weight. Well, then, of course, Remeron is a wonderful choice. Let's say somebody has, let's say, fibromyalgia or diabetic neuropathy. So their Cymbalta can be very effective because we've learned that that can help with pain, with nerve pain. Also, side effects. We need to look at side effects because if they're intolerable, the patient is not going to want to continue. For example, with the serotonin antidepressants, there can be sexual side effects, a decrease of libido or a delayed orgasm. If someone's had a history of a seizure, well then with Wellbutrin, that can potentially lower the seizure threshold, make somebody more likely to have another seizure. With the tricyclics, we have to look at possible cardiac concerns and maybe do an EKG first and foremost. Also, there can be constipation and dry mouth. And the medication effexor sometimes can actually increase blood pressure. So we look at all these various factors when we're trying to decide the most effective antidepressant. The other very important factor to recognize is that oftentimes, but not always, these antidepressants, well, they take 2 to 6 weeks before they really take effect. Of course, you may say, heck, I'm so depressed, I have to wait all this time. But yes, one does have to wait. Now, sometimes they can take effect very, very quickly within a week. And of course, there can be the placebo effect, just the fact that somebody's going for treatment and taking something can help them simply to begin to feel better. So one does need to hang in there and be patient. I would say the most important ingredient with medication treatment is for you, the patient, to speak up. This is a dialogue. Talk together with your psychiatrist, with your doctor. Speak up, ask questions, engage them. Don't just have the doctor take out his or her pen and just simply write a script and then say, see you in another month. Make it a dialogue. Get to know, let your doctor really get to know you. Speak up. Now, of course, there's other things that have become somewhat famous as of late. There's transcortical magnetic stimulation, which we can talk about at a different time. There's ketamine, which has proven to be extremely powerful, especially when people have a treatment-resistant depression, and also can be helpful for those who are going through suicide, because that can work quite rapidly. It usually doesn't have the positive effects in the long run. Usually has to be coupled with psychotherapy, which obviously is a good thing. But also I must say that having run a psychiatric hospital, I've also seen sometimes people with ketamine can wind up having dissociations and getting out of touch with reality. So certainly one needs to be careful with that. Depression. So sadly, depression is worldwide, and as far as medications goes, this is what we think we know here in the 21st century. We do know a lot more now than we knew 100 years ago, and 100 years from now, well, they'll look back and realize how little we know now, but we have to do the best we can in the time in which we live. I hope this video is helpful for you. The main thing is to really engage your doctor in a real discussion about your treatment. Don't just let it go quickly. Don't just say, doctor, whatever you tell me. Really engage and don't be afraid to speak up. Of course, also there's the spiritual way to look at how we are, our mood, and to recognize that by having a clear idea of who we are and why we are here in the world, to wake up every day with a sense of gratitude and a sense of mission can make all the difference in the world. There's also to recognize what we call the healthiness of depression. Yes, sometimes we have to go through these difficult times because that's an opportunity for us to grow, an opportunity for us to learn and to make our lives better. But again, there are many people, sadly, who suffer from a real dark, palpable depression, and then medication can make a world of difference. Medication will get that person out of the pit of depression, and then they're on the, even playing field. And from there, they can use their strengths, develop their strengths. They can work on reconfiguring their neurons with positivity, with a sense of mission, with being connected in a spiritual way. And together that can make all the difference in the world.